So the first network I want to share with you is within the microcredit, national microcredit movement. And so some of you know that microcredit, microbanking was born from work that was done in 1976 in Bangladesh. Professor Mohammed Yunus went over there and discovered that there were huge problems with loan sharks and helping people get credit and out of poverty who were wishing to do that through their own businesses. Made his first loan of about $27 to a group of women who were making beautiful bamboo furniture but were held hostage by these loan sharks, were able to bypass those loan sharks and make a fair profit for their work. And in the process discovered his personal passion and the mission of the Grameen Bank. He had a lot of detractors at the time that thought his ideas were not just revolutionary but wrong. So he had detractors on the left and a lot of political and religious detractors on the right, thinking it was a crazy idea to give the poorest of the poor credit that had no traditional forms of collateral. And he was asking all types of questions about the integrity of their financial institutions and about our societal norms and how we believed and viewed poverty and the poor. But fast forward 30 years, many of you know the story. Mohammed Yunus and the Grameen Bank received the Nobel Peace Prize because during that period of time, they'd made loans to tens of millions of people and returned those loans for tens of millions of people and pulled millions of people out from the lowest rungs of poverty. Tyler Norris, who you met yesterday, and I had a very small chance to participate in the microcredit movement. We were doing some work in Russia and Central Asia with parks and protected area systems, and because we kind of knew the environments of Tajikistan, we were approached by Save the Children and the Soros Foundation to help them launch a microcredit program. And Save the Children wanted to focus on women who were refugees that were victim of a war, an ongoing civil war in southern Tajikistan, who found themselves in the capital city of Dushanbe. And Save the Children thought microcredit might be a strategy to help stabilize their lives. So these women who had mostly watched, in many cases, their husband and their boys assassinated, took on loans, and the magic of microcredit, in this particular form of microcredit, are lending groups, peer lending, wisdom circles, if you will. So these particular women were making beautiful dresses and clothes, some formal, some informal, and some food products. And they're in these groups, just like you would be at your table. But the key is that they help each other, there's a built-in collaboration, succeed by making sure that their businesses return their loans so that the rest of them get the next level of their loans. So a built-in incentive to collaborate. So they're tapping into each other's wisdom, trying to figure out how do we build our food products or how do we make our dresses so that they're the most appealing and how do we get them out faster and where are the markets? And so they're coaching each other, they're encouraging each other. Sometimes they're actually jumping in and helping if they have deliverables that they're not going to make. And these women that are in some of the worst conditions you could imagine, having just moved into this big city with husbands and kids that had been shot, returned their loans over the course of 3 years, and now it's continued for much longer than that, at a 97% rate. The poorest of the poor, people that we would count out, we can count in if we create conditions where they thrive. And so there's the power of a network, and this is taken off in a lot of different forms, and not just microcredit and Kiva and so on, and other forms. But what I want to point out, two lessons that at least I take away from microcredit, is that networks that are strong, that work, have a built-in incentive to make sure that we have a stake in each other's success, no matter what that is. And the second is they're designed for results. Results are contagious. And so the microcredit movement has been built around a results mentality. And I think Shoma may actually talk a little bit more about some of the methodologies they've been doing to get results in some of their work. But they had a results mentality as they went about kind of returning their loans. Next network I just want to touch on briefly, and my friend Monica Hobbs-Van Leeuwen is here with the YMCA, is about 10 years ago, the YMCA kindly invited us in to kind of help them as they were launching what was their Healthier Communities initiatives, the Pioneer Healthy Communities. Some of you may know a little bit about PHC, and they'd received CDC funding to basically go out and create place-based change efforts, and this was 10 years ago, doing work around healthy eating, active living, using policies and systems of environmental change, which was very foreign at that time for anybody, let alone the YMCAs that were brilliant at creating programs mostly within their own facilities. So what evolved is a model in which the Y started to invite communities from all over the country to come in groups of approximately 10 businesses and not-for-profits and community-based leaders to get outside of their environment, to have a transformative experience where they started to build commitments with one each other, to get smarter about how to create collective change, and to learn from thought leaders and to start to build their kind of collective efficacy. So not only smarts at their local level, but to start to build a network. And I was sharing with Monica this morning, I was looking about the harvesting after a couple of years as this network is saying, what works? And this is what they built their leadership capacity around. These principles, these touchstones, start with a shared and compelling vision and a spirit of inquiry. This notion that we don't have to have it all figured out before we start to learn our way into it. The second one was to adapt to emerging opportunities. And a lot of these PhCs realized that they may have started with a park or a corner store, but this would mushroom and blow into something that was much bigger if they allowed it. Borrow from others and build your own. That we could learn from each other. We can learn from what the best school districts are doing with changing their procurement policies, whatever they may be working on, but we needed to build and adapt our own. It needed to look different in every place. To engage cross-boundary leaders who care. At the end of the day, we need to go beyond just organizational self-interest, but we actually need to discover where our broader interests and our deeper missions and our deeper levels of caring. Use data not to guide, not to drive the effort. I remember the first time we read this off with the CDC that was funding us, and they were in shock because it was, well, data should be driving. And again, it's semantics, but it was the wisdom of the community that data needed to be there alongside us, but data couldn't pop out all the answers. Develop leadership structures that distributed ownership and action. And so over the course of time, the YMCA's grew to about 247 place-based change efforts, changed 40,000 policy or environmental changes that reached 70 million people over those 10 years. And in child care policies, in school settings, procurements, hospitals, changing the built environment. And one of the things that's really interesting, I was in Wichita, Kansas the other day, ran into Mim and some other folks, and that same group is intact doing the work, and somebody from the Kansas Health Foundation said, that's been the greatest force for change. $30,000 to build the capacity in that group has started to change the way, and continues to change the way Wichita does business. Because at the core of this was a group of committed leaders that care that started to ripple out. So a lot to learn from YMCA, which is how do we build collective leadership? Another beauty of it is, I think the Ys do as well as anybody, and it's not, the Ys aren't alone, is telling stories to drive change. Telling stories horizontally and telling stories to affect policy change at local, state levels, and national levels. Final network I'm just going to touch on briefly is the Community Commons, which is a virtual network. Some of you are familiar with the Community Commons. It's really a portal that's designed to spur actions and investments in healthy, sustainable, more equitable communities. And so provide thousands of data layers that are relevant to communities that are trying to do this work, to change makers. And the way that it happens is in the Commons. The Commons, the whole notion is everything that we create and share together, right? So we give away lots of free tools on there, and people are able to kind of pull into what another map was. I was in Madison a couple of weeks ago, and somebody from Madison said they pulled up a map, and I think it was from Fargo, North Dakota or somewhere, on homeless youth and access to some particular service that they were looking at, and they traced who created the map in Fargo, contacted them, and learned about a program that they're still now starting to pursue. So there's this serendipity in a network that happens at this broader level. There's some other tools that are kind of really supporting some deeper collaboration, which I think if we're going to do collaborative work, we need access to better data, and we need to actually leverage technology for the good. It can't lead, but it needs to be there. The other kind of fascinating thing that's emerged in the Commons real quickly is this idea that we can build a lot together. We have all these different network players. So the Centers for Disease Control, for example, they built a vulnerable population footprint tool, and it was supposed to be just for their grantees, but with the technology, we're able to make sure that that's available to everybody. When Kaiser Permanente asked us to kind of create a community health needs assessment tool for them, we could build that for them, but we said, you're a partner in the Commons, let's give that away to everybody. And that's how the Commons work. So now not just Kaiser hospitals or Kaiser communities, but everybody has access to some very powerful community health needs assessment tools. So what we thought we were going into and what we continue to learn, that if we're at our best with the Commons Network, that now is about 18,000 people and 15,000 people regularly contributing and sharing 2,500 maps that have stories behind them every month, that if we're at the best, we're realizing that we're in an ecosystem and that we need to pay attention to what's our best and biggest contribution to this ecosystem. And when our team's gone off and built things on our own and not really paid attention to how we might support some other groups that are building an equity atlas, let's not build another equity atlas. They've done that beautifully. Let's figure out how we can augment it and spread that. And I guess that's my encouragement and a bit of my question to this group, which is there's enormous work going on there, some extraordinary work that we heard about yesterday around resilience, around well-being, around wellness, around health and equity. And there's some really special ideas, there's some gifts that I think are embedded in this kind of emerging network, which is what is our greatest contribution, or what's most needed to allow the declaration, the vision, the values that we were talking about this morning to happen? What's missing and what's needed, and what's our greatest contribution within this larger ecosystem? Let's not start to kind of venture off on our own.